Okay, well, welcome everyone. My name is Dr. Harpreet Nagra. I'm a licensed psychologist and VP of Behavior Science at One Drop. And I'm thrilled to be talking to our very special guests today, Mariah and Dereck. We're going to be talking about a number of different things related to the novel mental health challenges that COVID-19 has surfaced for us, in particular for people of color living with diabetes. Our conversation is going to be focused on what it's like to live with diabetes and to be managing the stress that's we've all experienced during this pandemic. So before we get started, let's get to know our guests. Mariah and Dereck, would you mind sharing your name, how long you've had diabetes, and sort of what your journey has been like to advocate for mental health among people of color living with diabetes? Mariah, do you want to get us started?
Sure. I'm Mariah Rankin-Landers, and I have been living with type 1 diabetes for 32 years, diagnosed when I was 12. And I co-founded an organization called Studio Pathways. And so I lead for culturally responsive teaching and learning through the arts and education. And I am an advocate of Black folk, like with type 1, having a richer experience in the landscape of the wide network of diabetes, because I think that we've been far too long pushed to the sidelines and marginalized in ways that don't support us. So I'm very happy to be here today.
Yeah, thank you so much for your work that you're doing. Can you say a little bit more about your organization?
Sure. So I'm a former classroom teacher, former administrator, and really stepped outside of the institution in order to lead for nationwide school change. And so what I really am about is the cultural change that it takes, the internal practices that it takes to move schools forward. So tending to teacher practice and tending to whole school systems so that they are anti-racist, so that they're love-based, so that they're joy-based, and really disrupting the patterns of harm that have been established over centuries of white supremacy, and disrupting the ways that we continue to, have testing for students, standardized testing, which is just not fun and unreliable. So there's a lot to it, but that's my main course.
Well, great. Thank you so much for sharing.
Yeah, thanks for asking.
Dereck?
Hi, y'all. So my name is Dereck Alexander. I'm a type 1 diabetic. I've been diabetic for 27 years. I was diagnosed at a really young age. I was diagnosed at 3.5 months old. And as far as like why I'm involved with advocacy, as far as like amongst diabetics with mental health, it's a very touchy topic for me, and it's something that I'm now honing in of owning pretty much now, because it's just that like back then, like when we were all like younger, still fresh, and still trying to navigate our childhood and our adolescence through diabetes, like I just felt like going through my years of living, navigating through diabetes, I never had really anybody consider my mental health. And as I'm getting older, I've done a lot of reflecting, and I realized that if I would have just had that mental health counselor, therapist, psychologist, or somebody in the mental health field, if I would have just had that paired with my diabetes care, I'm great now. I'm great now, but it would have just been different and a better light. And I want that for the younger generations that's coming above, or not even just basically generation, but anybody who's newly diagnosed or even burnt out. I want them to have that access to the mental health aids that can be provided to them.
Yeah.
And as far as like, I'm pretty much like, I was really active when I was like little, as far as like being like a diabetes advocate. I'm also going to talk about like later on, like in our conversation about like burnout. So my burnout really occurred during my adolescent years, and I'm glad to survive that. And pretty much with that, with that burnout, it was overwhelming. But I just want to know, like, pretty much I want people to know that, like, the diabetics know that even with the burnout, even when being newly diagnosed, or you just want to take precautions before you even get to a certain place where you're not mentally well while living with diabetes and navigating through other identities. So that's
Yeah.
what like had me get back in the game and pretty much trying to make a change. Uh, right now, I'm like working with a nonprofit organization that centers around helping BIPOC, Black Indigenous people of color, to get who are diabetic and their families as well, families and friends to get the resources and necessary tools that they need. It's by the organization Kyla Cares, and it's founded by the founder, Kyle Banks. And pretty much, even though things are still new, pretty much the change is going to come.
Yeah. I think there's a number of like really sort of key nuggets that you shared there, Dereck. One is it's challenging to, find resources, mental health resources when you're just living with diabetes alone, right? Not alone, but it's just even when there isn't a pandemic happening, it's hard to know who to turn to in terms of mental health resources. There's not that many specialists out there, diabetes psychologists or diabetes counselors. There are some, but it's hard to know where to look and where to find them. And I think one of the other things you kind of hit on is that we've seen that, actually both of you kind of shares that we've seen that during the pandemic, a lot of the sort of systemic issues have been brought to the surface much more than before. And it's wonderful to hear the different organizations that you all belong to who are working in their own ways to lift some of that systemic racism and concerns that are coming up for folks. One of the things I want to kind of shift our attention to is that during the pandemic, especially, that were kind of put on pause for us or were put on hyperdrive for us in relation to how we take care of our mental health. So things like our physical activity, like common stress reduction types of techniques, that coping strategies that we might use to help reduce stress or eliminate stress in general, like working out, spending time with others, socializing, turning to our community. Some of those things weren't as readily available as they had been previously because of the restrictions around quarantine and what the pandemic had brought. And I'm just curious, during the pandemic, for you all, what aspects of your life seem to kind of be put on pause? And, as a person living with diabetes, what do you feel like were some of the barriers that you perceived in relation to managing your mental health?
Is this like, I would say mainly around the pandemic and COVID-19, right? Like the barriers and stuff.
Yeah.
Okay. I would say that it was okay. So I want to just like pretty much like touch on the topic of like I said before, like having different identities, fulfilling your roles that you occupy in life, and being diabetic is already itself is a barrier or a challenge. So that's just what it is right then and there, because some people who are diabetic, their moms, their dads, their youth advisors, their farmers, diabetics carry other identities because obviously we're human. So for me and my experience, like I pretty much was a caretaker, and I didn't always have myself first as far as like with my diabetes. I did okay, you know what I'm saying? Like I did okay, but I also had my moments where I had like a really major hyperglycemic level, and on the contrary of like having a hypoglycemic level as well. I pretty much went into a deep hole, not I guess you could say depression. I went into a depression because our lives were put on pause. So we are mandated to stay home. We can't really go outside. Me as a person, I'm a extrovert, introvert, extrovert, and I thrive off of social settings and being social with people. You know, I like to take my time and my breaks, but I'm more of a social person than being like, non-social. So that took a toll. And then you have your pandemic snacks.
Mhm.
So it was just stress eating, weight gain. It was, oh God, it was a stress eating, major weight gain. Also like not really having that great of an access to your healthcare because we couldn't see our providers in person. So that put a stint on things, and then just trying to like get through it. Now that was pretty much like the con. Now there were some strides in trying to make things better. Like, so I got into doing yoga because they had pretty much, it was called, I think it was Downward Dog. Yeah, they was offering, it was a yoga app that was offering service for free during like the pandemic. And I really got into it. I realized that sometimes like, if we may use something like exercise, we may use that to pretty much combat the negative effects of like our emotions, our thoughts, our whatever it is that could possibly cause like a negative impact towards us. It's that you may not be able to like run or lift weights or do like, the exercises that you were able to do just because you were limited and you just like took a pause. But it's just like you have to find a niche where you could fall in to be able to, complete like those little goals like that you'll set for yourself. Then you can like make your way back to where you were originally. So that helped me out. And also like the pandemic, COVID-19, it forced me to start cooking more, which I'm grateful for as well, because now like that also the trajectory of me like really getting involved in cooking, and especially taking my health in consideration to make sure like what I'm using and stuff.
Yeah. Well, I think you kind of covered the full spectrum of experience that I think a lot of folks had, right? Of wanting to exercise, wanting to, still be healthy throughout the pandemic, but noticing that a lot of our sort of usual go-tos were just not as readily available as they were previously, right? So like maybe there was a little bit more of like stress eating or emotional eating that was part of this whole process. And then, your roles changed completely. Your identity of being in different relationships, maybe, how you show up in those relationships changed, and how you wanted to participate wasn't exactly how you got to participate in it. So that, I mean, all of those would be significant stressors. I also love your approach around, taking it day by day and focusing on, the yoga, focusing on what you have control over in that moment, and allowing yourself to kind of really just try to be as present as possible. That's wonderful. Mariah, how was the experience for you?
Yeah, I think my roller coaster ride maybe started off a little different. I went into like hyper vigilant mode, and which is something that I think a lot of diabetics have, is like this super vigilance around what is happening. It's like our second brain is always navigating the world, and we can never turn it off, right? And that's part of the exhaust that we feel. And so I like charged that part up of my brain. And I was on one of the last flights from LA to Oakland, like the day that the announcement came out that there was something happening in Seattle. And I remember like people on the flight were, a couple of people were wearing masks at that time. And my friend and I just took our scarves and just like wore our scarf over our flight. But it was totally terrifying. And I just shut it down. Like I got home and I shut it down before there was any official shutdown. And so my friends were watching me kind of like build this fortress and like taking cues of like, oh, well, Mariah's like reading the world in a different way because they know that I read the world differently as I walk this experience with type 1. And so they started just kind of taking on some of the actions that I was doing and was like, if Mariah's not going to go out, we probably shouldn't either. So I was super, super like vigilant, right? And then I just like, I was like, this is not sustainable. So then I figured out, I did have a huge care community. So a lot of my friends would bring me groceries, et cetera, until I felt comfortable, which was maybe like a month or two. I can't remember the timeline, that I finally was like, okay, people are still going to the grocery store. I can do that. And then I just started like I quit the gym immediately, but I was fortunate. I am fortunate to have the ability to buy a treadmill. So I bought a treadmill and put it in my garage. And then I just started walking my neighborhood. Like I had never walked my neighborhood before. Like I didn't know these streets.
Right.
And now I'm like, I know my neighbors, I know the paths that I like to take, and I like run up and down these streets like twice a day now. I bought a trampoline. And so I was doing like jazzercise. I'm like, let me bring this back into my life. But it got really, really tough. I would say by January, I think I had really met my, like, this is devastating. Like the lack of being able, like I didn't go home for Christmas to see my mom. I couldn't see my sister. She lives in a group home. And my friends, everyone was were just cut from each other's lives. So that was devastating. And I reached out and tried to get mental support services. And it really wasn't that helpful, but what did help was reaching out to a spiritual practitioner. And so I built in like weekly meetings with a spiritual practitioner who was able to like bring me back to a place of mental health and well-being, which brought a lot of service. So yeah, it's my pandemic story.
I think
that's really good. Like,
yeah, go ahead.
Oh no, I'm sorry. No, I was just saying like it was like your experience is like, I'm like really like, wow, like I never, it's just, I'm sorry, I'm just always in awe to, it's like, I never really had, the only time I ever like really had the chance to socialize or even communicate or just be in the same space as other diabetics was when I went to a diabetic camp. And that was just 1 week out of the year. And that was pretty much the 1 week where I and my other fellow campers were, we felt normal. And that was like from the early 2000s to like, you know, as time went on. So just like always hearing like another type of diabetic experience, I'm like, wow, so this is how life goes for you.
Right? Can we talk about camp? Like, I agree. I just wrote this article about summer camps, and that network, that community, I think has like saved my life as an early child. Like I was able to like see counselors living with type 1 diabetes and see that I didn't have a death sentence. That was mind-blowing when I was 12 years old.
Yeah. Well, I think the theme that I hear in all of this is that there's, you know, managing mental health or managing stress that's coming on. It doesn't necessarily have to be the traditional route of when you're stressed, go see a therapist. It can come from other sources too. So it might be from a camp that you go to, like a diabetes camp, or it might be a spiritual practitioner that you reach out to. It doesn't have to be that traditional therapist or psychologist or psychiatrist providing those types of resources. And I think sometimes we forget that, and especially, you know, living in the Western version of what psychology is and mental health means. Sometimes we forget that culturally, many communities of color just function better from reaching out to who's already in their community, people that they feel comfortable with and safe with, and systems that they know well, rather than trying to navigate through the sort of professional mental health system that exists out there. That's a great point, I think. The other thing, Mariah, that you mentioned that kind of stuck out to me is that there's a lot of there was, possibly still is, lots of like health related anxiety. So with the pandemic, you know, I've heard from a number of folks living with type 1 that, you know, they are in the high risk group. They perceive themselves as being potentially more vulnerable than others. And medically, we know this is true as well. But it's amplified how much they want to kind of protect themselves and almost like cocoon themselves during this experience. So that might mean not potentially avoiding social situations where masks may not be as mandatory, or avoiding social confrontations where you have to reinforce social distancing because it's not just kind of naturally discussed or labeled for everybody. But I'm curious for both you, Mariah, and for Dereck, like how have you all managed your health related anxiety during this time?
Mariah, you can go ahead.
I mean, anxiety and diabetes has been from jump, right? So I've had to really develop capacities and skill sets to manage that. A lot of them have been tied to my spiritual practice from my childhood. So meditation, like I used to teach meditation practices when I was a teenage to my peers. Like song and chant, like those are the things, my breath. I always return to those things when I feel anxiety setting in or a panic attack about to happen. I know how to go and enter my breath. And then honestly, sometimes I have to call my friends and just be like, can you talk me through a 4-count breath?
Yeah.
And that is very, very helpful. I will say too, that I have learned, I think a lot of us have really learned to like stand up for ourselves. Like we might be in a situation that puts us in danger. And so I am very used to just telling somebody, you know, like this instance, I started sailing lessons as part of my pandemic relief, stress relief. And my sailing instructor, there's 4 of us that are in a lesson, and I show up and I say, "Are you vaccinated?" And he's like, "I don't know about HIPAA if we're allowed to like reveal that." And I was like, "Look, here's my story. I need to know this is for my protection, and I don't feel comfortable being here unless I understand what the situation is." And so anyway, but I'm used to just being like bold and in people's faces to say, hey, I need help, or I'm low, I need this or that, or the other. I've had many embarrassing situations where I've had to like reach out to a stranger or like in a laundromat and walk up to a clerk and just be like, hey, if I pass out, can you call 911?
Yeah.
You know, it's like, yeah, being bold and brave in that way.
Yeah. How do you feel like you got to that place? Because I can imagine, you know, people might be at different portions of their health journey and being able to advocate that boldly or that strongly for themselves. But what do you think helped you get to that point to be able to say that?
I mean, honestly, I think like Dereck was talking about not having support as a child, like that is very true. I had a sibling who had more needs than I did. And so I, from jump, like had to learn how to do everything on my own as a 12-year-old. And so because of that, I became very self-reliant, which is something that I'm still working at. It's like how to receive support. But because of that, I very quickly learned how I had to speak up for myself and advocate for myself when I was in 7th grade. I remember giving like a presentation after diagnoses because I peed my pants in front of my 7th grade class, which is how I found out I was diabetic. And so I had to return to that class, and it's unbelievable to think of now, but it's like, wow, a child returned to the class and was like, hey, here's what happened to me. Here's how you can help me.
Right.
Yeah. So it was by force.
Yeah, it sounds like tons of forced practice from a very young age is what kind of got you to this point.
Yeah.
Dereck, how about you? How about if we start out with, you know, a COVID-related health anxiety? How have you been managing that, or what's been coming up for you?
Okay, I'm glad you reiterated because I definitely was about to ask you like, now what were the questions? Okay, so I'll take it from the March when we had the shutdown. So at first I was just like, okay, what's really going on? And my anxiety wasn't at all, it wasn't like at an all-time high, but it was kind of like, you know, it was on a low ball, like a low roll. And as time went on and more people was getting sick and even the deaths that was occurring, and I was just like, how is this going to affect me because I'm diabetic?
Mm.
Is this going to be more dangerous, impacting toward my health just because I am a type 1 diabetic and like I'm already like, autoimmune, like, like my autoimmune and this, that, and the third. So it's just like, honestly, it's crazy, even like, not to digress, but just like anything that comes out affecting people's health, I'm like, okay, how is this going to affect me just because I'm diabetic and my body does what it want to do sometimes, So it was very like scary. At first I'm not gonna say I didn't take it. I don't gonna say I didn't take it seriously. It's just I didn't know where to go or how to take it until they had more resources, more information that was put out, and then it was like, okay, I need to wear a mask. And then it gotten bad to a point where, okay, people need to stay at a distance. And just like how, like Mariah, you were saying that you were very cautious about going to the grocery store and doing X, Y, and Z, this and the third. I kind of like just felt on my own, and I kind of always felt like a person like I need to do things for myself, and I don't want to burden other people doing things for me, and that took time to get out of as well. And also, like, this Hurricane Ida has reinforced that. Be so self-reliant, and like, don't be afraid to ask for help. Don't be afraid to say that you need something, because I mean, at the end of the day, closed mouths don't get fed. So that's always something to like work on. And then actually just like, just trying to like navigate myself and make sure that I take precautions. And my family member that I was caretaking for had cancer. So it was even more like, it's like, I have what I have, you have what you'll have. These are the cards that are on our deck. What are we putting down? Like, so it was very daunting in a way, as far as like just trying to like wrap my head around the pandemic and trying to take as much safety precautions as I was able to take. And when so I had contracted COVID like not too long ago. And when I tell you that it was bad, like bad is an understatement. Like it was horrible. Now I will tell you from like a diabetic standpoint, I was lucky compared to others that my blood sugar levels didn't fluctuate bad like how it could have been, because you just don't know how it's going to affect your body, I will say that it was running a little high, but also I had fever and all the other symptoms that that could have your blood sugar fluctuating. But that was the main thing, was like my blood sugar was like just slightly run a little bit high. And then also I wasn't able to eat. Like I wasn't able to eat for days. So that was very concerning, because I didn't want to suffer from like a really hypoglycemic level, So it was just, one, I'm trying to get better. Two, I'm sick and I don't know what to do about it besides lay here. And then three, how am I going to really pull through this and make it through? Because it's like, at that time, it's like, yeah, I have diabetic friends and this, that, and the third, but they didn't catch COVID. They didn't go through it. So it's just like, I'm really like relying on my healthcare provider and any other information that I had the energy to even like look up and see, because I definitely did not have the energy at all either. Yeah. But that's just like how I like navigated through, I guess, like, just the pandemic, and also how to get through COVID by having it. And
I'm so glad you're okay.
Yeah, I was just gonna say, do you feel like your sort of anxiety levels have changed pre and post having COVID?
No, it didn't. Yeah, pre and post COVID, like it didn't really. It wasn't really badly affected.
Okay. Yeah, because I mean, it sounded like before, that diagnosis, it sounded like there was a lot more, you were curious about how is this going to impact me? What do I need to do to take care of myself? Do you feel like having had it changed any of that, or do you feel like it's still?
Oh, yes.
Yeah.
Yes, like having it. Okay, so I'll go even deeper. Okay, so I pretty much I went to the ER. No, I lied. First, I went to the urgent care because I thought I just had an upper respiratory infection, sinus infection. Like it was just something that I didn't think it would be like really COVID.
Yeah.
And got tested, and they were like, "Oh, your test came back positive," and they told me that over the phone so they could like decrease the level of like people interacting with the patients who possibly or already are positive, just to like break that chain. And so I was instructed to go to the ER to get something that they didn't have available. So it was kind of a blank trip, but just going to the ER and sitting in there, and it was bad. They just pretty much sent me home as well. And that's another thing to talk about, like just how being like Black and going to a predominantly Eurocentric center, i.e. the hospital or the ER, and just not being handled correctly, to be honest with you. Like I wasn't like, it was just like, oh, you're gonna be fine, slap a band-aid on it and just send you on your way. And I'm just like, I live alone right now at this point. Like I don't feel comfortable staying at home. I had pretty much, they just ignored what I like my concerns, which in healthcare, no matter if you are a tech or even a doctor, you never ignore a patient's concerns that affects their health and well-being. And so they discharged me, sent me on my way, and I came back to the ER again because I was feeling even much more worse. I got to the ER, and by the time when I arrived at the ER, like I lost sensation in my legs. Like I couldn't get out the car and walk, so I had to be wheelchaired into the ER. And I ain't gonna lie to you, the second trip to the ER, that's where the anxiety broke the glass ceiling and you just go numb. And I was just like, am I really going to get through this? Like, is this really going to take me out? And what helped me was mentally reinforcing those affirmations and positive thoughts, like fight, like I don't know if y'all seen Kill Bill, but pretty much how she was telling her, telling herself, wiggle your big toe. It works. Like I was just telling my body, like fight through this. You have so much more to do on this earth, and you have so many people to impact. You have fight through this. Like yes, it's physical and it's your health, but we always forget about the mental, because the mental also has their hand on the shift stick to drive the plane. So,
Well, I mean, I just can't imagine going to the ER, having the healthcare professionals there minimize your pain or minimize your experience in some way, invalidate it, and not give you the support that you need, right? But it's a very common experience amongst people of color that is how you're treated. It just purely on sort of how you appear to the medical professional. So I wonder, from both of the experiences that you and Mariah have shared, there's lots of potential opportunities where burnout could have been right at the forefront. Could have been done with, managing the diabetes, managing all the sort of pandemic related tasks that we all had to do, right? How did you all, well, first of all, was there burnout for you? And then if there was, how did you cope with that burnout during the pandemic, or are you still coping with it?
Honestly, the burnout hasn't been as bad in the past, and that's mainly because I've gotten older, and by us getting older, there's more windows open for complications, So I guess to be hyper vigilant about, okay, how can I prevent these complications from even arising? So that's where it is, and it's subconsciously anxiety driven more so than like on my forefront, like, okay, because at one point in time, there was a small window during the pandemic where I was just like, okay, my blood sugar levels was rising. But yeah, they were rising because of the stress and stress eating and this, that, and the third. So I pretty much like I had a nice moment where I was just like, what am I doing?
Mm-hmm.
Where am I going? How do I get through this? But it just takes some like self-work and self-practice. Not
Mm-hmm.
That's not the only thing, but that's what worked for me to keep my self in check.
Yeah.
But really, I think what helped me, and it could help other diabetics as well, is that you really have to be, not only have to be real with your endocrinologist or whatever, like whichever provider that you go to, but the first person you have to be real with is yourself. And you cannot sit here and turn a blind eye to yourself. You cannot sit here and tell half truths to the people who are supposed to be helping you. If you're eating bad stuff 7 days a week, you just have to own it, you know? Like you have to like really sit there and just like, yes, I've like you have to be honest with yourself and admit the truth. Like, yes, I've done this, that, and the third. And with being honest, it's like don't feel guilty, because I think that's what those two constructs of being guilt and shame
Mm-hmm.
is what perpetuates the behavior of like continuing to not lead like a path of like, trying to be on track ish. Because I'm not gonna lie to you, like I have my moments and I have my days where I want to eat bad food. Like I want to have a moment. I want to have a bad meal.
Yeah.
Sometimes I want to have a bad half a day.
Mm-hmm.
And, I just try to make sure I take the necessary precautions. And sometimes it works and sometimes it doesn't. But I need to still feel like a human. I still need to feel alive, because to I'm not saying that it's impossible for people, but to not be able to just have a moment where you could just not think about how this particular food item is going to affect you.
Mm-hmm.
Like it brings me peace. But back, not to digress, but it's just like you really have to be honest with yourself.
Yeah.
And once you could like take accountability, then you could see where you're doing wrong, and then you could make efforts and better strides to correct those wrongs.
Yeah.
Yeah.
Yeah. So, I mean, it sounds like it really starts from being able to do that self-reflection piece and do it as critically honestly as possible. Because if you end up not being honest with yourself, then it'll be hard to be honest with other people around you too.
Yeah.
Yeah. What about you, Mariah? How do you feel about, diabetes related burnout during the pandemic? Have you experienced it? Are you still experiencing it? How have you managed that?
I have so much I want to just like go back and address with Dereck. Like it's so
Yeah,
fun to like
go
get
for
the
it.
minutes I want to just be like, oh my gosh, let's talk.
Yeah.
So I've got to say, like,
as well. Sorry.
yeah. When you're in the hospital, so because of my hypervigilance around my diabetes, one of the things that I did in preparation was to like make a Google spreadsheet of like how to take care of my body, because I don't trust the health professionals. I was like, I know folks don't know how to do and manage type 1. They get very little training on that. And that is so worrisome for me when I consider what happens when or if I need to be admitted to the ER. So I'm really glad you made it through.
Yes.
The other thing is like you're talking so much about the point around well, I can't remember the exact phrasing, but what it made me think about was like our level of persistence, and like, the trope of the strong Black woman is so real. Like I've had to live the trope of a strong Black woman. And with that, I've had to push back and learn how to open up and invite community in to support. And that's an ongoing practice for me, because I've really had to grow up and develop into these racialized ways that we are seen and perceived in the world and carry out. So that has been, so I say that to say, one of the skill sets that I think has been really helpful is my level of persistence and how I continue to engage in a fashion that allows me to maintain a sense of well-being in the harshest of times. And burnout is real, absolutely real. I totally went, and by the time Thanksgiving hit, like that was kind of it for me. It was like, I'm eating all the things. That's when my weight gain happened. That was like, you know, I had been pretty committed to like eliminating a lot of carbs and sugar and things that I would probably just normally eat. But when COVID hit, I was like, let me just have a very specific diet, which didn't turn out great, Dereck. I totally got ketones, so don't recommend it. But
was it because of the low carb part? Or?
Yeah, the low carb part like really took me out. It took me out. So don't recommend that. But when I started eating a lot more carbs again, I certainly started gaining weight. So and that's kind of when the exhaustion hit, was like we are still in this. I need some level of relief, particularly with getting back into community and getting back into being able to see people. So I started to really figure out how I could safely interact with my friends and, you know, do backyard gatherings, things like that. But I do think we are phenomenal in how we have these mindsets that we've had to develop that give us like acute awareness and reactions to living in the world as we do in our bodies. And those are gifts. Those are gifts and those are strengths.
Yeah, they are. And I feel you on that. Because another thing, like, not to interrupt, like when you just said like we have like another awareness, and honestly, that's also what's helped me survive since being diagnosed and having an awareness of, I don't want to say aware, because I was just telling my friends before coming on to this, I was telling them, oh, like, you know, going to be speaking this and the third, and she was asking me like, how did you navigate through your diagnosis? And I was like, to be honest, I was so young, I just grew with it. But more so, it's not about how I navigate through the diagnosis. It's more so just trying to like just having that, I don't want to say closure and I don't want to say coping, but just having that moment of never not being diabetic, if I said that right. Yeah. So just having that, like, just to have that field day of, I don't have to think about finger pricks. Well, I mean, I don't have to think about finger pricks right now because I have a CGM. Thank God. Like, thank God for CGMs and insurance cover it, because it's a whole new world.
Yeah,
but
definitely.
It was just syringes and finger sticks. Like, that's what it was. And I just had to grow, I grew accustomed to it and just, being it. But we do have that other awareness that it's really a strength. It really is. It's not a blessing and a curse at the same time. No, it's really a strength because that's what keeps us living and keeps us surviving. I think another component, which is going to be like a sub heading burnout, would be the idea of having to explain your diabetes and also having to just not explain, educate, and being prepared to be questioned and interviewed by somebody who might know, or just being caught like doing like forming an action. And I don't say being put on blast, but you have to answer those questions right then and there, because they don't know. It's not necessarily being taught in school like that. And it was something. I'm sorry, go ahead.
I was just going to say, I think it's the education piece that can be additionally exhausting, constantly educating others who may not be as informed about it, who don't have to, make these types of decisions day in, day out, moment to moment around what might be happening. I hate to cut this conversation short. We're almost out of time. I could talk about this all day, but just as a last quick question for both of you, if you could if you had words of wisdom or resources that you want to share with others related to some of the experiences that you have had during COVID, are there any particular that kind of stand out to you?
I would say the brightest light in my life has been the camp community.
Mm-hmm.
And there has been a component of racism that I've had to deal with because they largely service white children, at least mine did.
Mm-hmm.
But that being said, Dereck, as you were mentioning, around the feeling of being around all type 1s where you don't have to explain yourself and everybody gets it, like there's just nothing like that. And so that is a constant source of like love and joy and relief.
Mm-hmm.
So I would recommend like getting into community with other type 1s.
Great. Dereck, how about for you?
Just to piggyback off of Mariah, I would say the same thing as well. Like as far as like the best way to get access to resources is like obviously you have your CDC, ADA, pretty much a Google search, but another like for the young folks who are very social media savvy, just typing in a tag of T1D, type 1 diabetic, like just searching those things will pull up so many pages, and then you go from one page, you go to another. Like I got more information with the organization that I'm like, doing work with is Kyler Cares. Like that has a plethora of information, and then diversity with diabetes, type 1, beyond type 1, I think. Just all in all, like looking, one little search will bring you a whole new library of resources. And there's also one that I've really been utilizing more to at least like, socialize with other diabetics is the diabetes app. You can look in your app store and they have like, I just had a notification just popped up saying like the question of the day. Like it's a cool place to, I don't want to say MySpace. Well, yeah, it's like a MySpace, Facebook for diabetics. And they have for everybody, they have all types, type 1, type 2, other resources. It's really nice.
Nice. Well, I think I would agree with what you both shared. There's just so many ways to figure out what your in-person as well as what your virtual community can look like. But I think the underlying theme here is that you got to figure out who your people are, all right? Who can you go to and talk to when anything related to this comes up, diabetes and mental health and so on. Given our time restrictions, I will say thank you both for your sharing today, for your vulnerability and courage in what you've shared with us today. A very special thank you to both for sharing your stories, challenges, the insights, and the wisdom that you've shared with us. And I want to say thank you to everybody who was able to join us virtually for this particular panel to hear about Dereck and Mariah's health experiences. Hopefully you found some inspiring and motivating words to support you on your own health journey. So thank you so much.
Thank you. It was a pleasure being here.
Thank you.